Hi, my name is Monica Chang, and I will be presenting on our project studying T1 mapping for the diagnosis of early-stage chronic pancreatitis. Chronic pancreatitis is characterized by progressive inflammation, impairment of endocrine and exocrine function, and irreversible morphological changes leading to fibrosis and scarring. The morphological changes associated with early-stage chronic pancreatitis often elude conventional radiologic and endoscopic imaging. This creates a need for higher sensitivity imaging techniques to diagnose chronic pancreatitis in the early stages. The Cambridge classification was developed in 1984 using ERCP for the diagnosis of chronic pancreatitis based on morphological changes in the pancreatic ducts. Recent guidelines by the American Pancreatic Association have recommended translational use of the Cambridge classification for CT and MRI or MRCP interpretation. Early chronic pancreatitis is associated with parenchymal findings, which often precede ductal changes, but these clinically significant parenchymal findings are noticeably absent from the Cambridge classification and are not featured in any other widely accepted classification system. So the purpose of our study is to determine if the pancreatic signal intensity on T1 mapping using MRCP can be used to detect parenchymal changes associated with the diagnosis of early-stage chronic pancreatitis. This retrospective study included 42 patients with suspected chronic pancreatitis who were grouped as having normal, equivocal, or mild disease based on the MRCP findings using the Cambridge classification. In total, there were 21 patients with normal pancreas, 12 with equivocal, and 9 with mild chronic pancreatitis. Region of interest measurements of approximately 1 square centimeter were drawn in homogeneous regions of the pancreatic head, body, and tail as illustrated in this representative image. Our results compare T1 relaxation times in our 3 patient cohorts. This box and whisker chart illustrates that there was a significant difference with a p-value of 0.0009 in the mean T1 relaxation times of the pancreas between the normal and mild chronic pancreatitis groups. Similarly, there was a significant difference with a p-value of less than 0.001 in the mean T1 relaxation times of the pancreas between the equivocal and mild chronic pancreatitis groups. In conclusion, T1 mapping is capable of quantitatively capturing subtle parenchymal changes that often precede ductal changes in early chronic pancreatitis. This enhances our characterization of early chronic pancreatitis and adds an extra layer of nuance within the Cambridge classification system, making it possible to more accurately diagnose chronic pancreatitis in the early stages and allowing physicians to intervene at an earlier point in patient care. Thank you.